You may have heard last week, this is still, by the way, an ongoing story. Medical specialists now having sent a letter to the premier directly, to Francois Legault, saying they've lost faith in Christian Dubé and trying to negotiate a deal with them. And that's just the medical specialists. Now you have family doctors, of course, in their own, if you will call it, negotiation battle with the government. And then in the midst of all this, out comes a story where the health minister, Christian Dubé, says, you know what, we have a lot of people, of course, who have been waiting over a year for surgery. I think that number's over 6,000 people. So what we're going to do is allow these people to go have that procedure done in the private system, and we're going to pay for it. And when I first heard that, I thought, well, that's good. It'll help clear up the backlog. And then I saw the opposition from pretty much everywhere to this idea. Aaron Derfel, Montreal Gazette investigative health reporter, is on the story. Aaron, thanks for being here this afternoon. Can I ask that question? Were you surprised that there was this kind of pushback once that was announced by the minister or not?
No, because I think that Christian Dubé had sensed that this was going to be somewhat controversial, this idea of paying doctors more money in the private system to do what could be in the public system. And he wants somehow to regulate it to ensure it doesn't spin out of control. But in regulating it, he didn't win any support from either the doctors who've opted out, the surgeons, the orthopedic surgeons and plastic surgeons who've opted out fully from Medicare, or union leaders. So at this stage, no one really likes the idea.
Okay, help me out here. So first of all, people who have been waiting, as I said, I think you report there's 6,200 of them, right? Have been waiting for over a year. You'd think that would be good news to people. You know, there's a lot of people waiting. I think the government has its own target, which is somewhere around the 2,000 range. Is the complaint that, and I think I understood this in the story, the government sets a premium, if you will, a price on what a specific surgery or procedure is supposed to cost, right, and what they would pay. What happens in this case if they're moving into the private sector? Did they acknowledge it would cost more?
Yes, exactly. And this is something that Santé Quebec would negotiate with the provider. Now, just to put it in context, because Christian Dubé, he implicitly acknowledges this is so controversial, he is cautioning that this would only be a short-term solution to eliminate the backlog. And in November, he's going to start with a pilot project, 125 patients. This would be medically necessary plastic surgery procedures, without going into too much detail, like breast reduction, etc. And then move on to orthopedics. There are thousands of people who are waiting for knee replacements and joint replacements. They're waiting longer than a year, so they would qualify. But the way that it's structured, in order to qualify, you have to have endured a wait of nearly a year, and then you would be getting some relief. But the surgeons who are in these private clinics, they don't like this idea of being overseen. You know, they're very independent-minded, they're entrepreneurial, and they don't like the government. Once again, they opted out of Medicare, and
right.
they don't like the idea that the government is butting in again in the way they run their clinics.
Is that because, to some degree, and let's understand, private clinics are for profit, right? If they were going to do a procedure, I don't know, say like, and it's not at the beginning, you can't have that done, but down the line, say you need a knee replacement, for example. Mm-hmm. Are they saying what the government will pay us to do this procedure is less than what we would pay if we were charging clients privately? Is that why they don't like it?
That's possible. This is something that Santé Quebec would negotiate. I think the main opposition is they don't like the idea that they want to have more freedom, and they want the patients to have more freedom. They would like patients to be able to, long before they reach the 1 year mark, to have the option of going to the private sector and having the government pay for this. And they don't like this idea of Santé Quebec negotiating with them. Pascal André Vendetoli, who's the head of this Association of Private Surgeons, he's requested a meeting with Geneviève Béran, the head of Santé Quebec, and literally 1 minute before their meeting a couple of weeks ago, she canceled. So he's frustrated, and when you look at this proposal, it's just so complex. And again, to put it in context, they could never do heart surgery or cancer surgery in the private sector, because you need to have an ICU in case there are complications. and they don't have that at the private sector.
Okay. So the other part of this, I think, that really stood out to me, I'm not sure if it's a medical specialist or the doctors who told their own head of the association, who had told them, this is not the way we should be negotiating, right, where we're giving demands to the government. They wanted now a mediator. They want to get rid of the mediator. You ever seen that happen before, where the head of the association that represents them has been told by the members, you know what, mind your own business and you shouldn't be doing this?
I think you're referring to the Quebec College of Physicians, that the president of the Quebec College of Physicians had said that you shouldn't be engaging in these pressure tactics, and then the doctors held an extraordinary meeting to try to oust the president of the college. I don't think that happened, but I believe he was reprimanded. What this speaks to is just rising tensions, frustration in dealing with the government, and it also speaks to the CAQ government micromanaging. This is something that we've seen in education, in other areas, and this is François Legault's style. And he's not winning. He's actually, creating enemies with this approach. And I think, so this is a separate issue, which is what you're talking about is Bill 106, and this is regulating the pay of doctors within the public system. Now, this thing that we were just talking about a moment ago, this is because there are 6,200 patients who are waiting for surgery for more than a year, and there are 150 operating rooms in the public system every day that are empty because they don't have enough staff. So Christian Dubé is saying, well, maybe as a relief valve, we can get we can eliminate that backlog over on the private sector. But a lot of these people have gone from the public to the private sector, and as they go from the public to the private sector, they weaken the public sector. So this is why opponents are saying that this is a slippery slope, that the CAQ government ideologically it's showing more of a willingness to embrace private sector solutions. But given that we have just a limited number of health professionals, you can't invent new staff. So you're just like shifting the problem from one sector to the other.
Just as a final question, Aaron, because I think most people might agree, we've never seen the healthcare system, and I don't want to use the word shambles the wrong way, but things seem to be going from bad to worse. And then I read as well that, people are calling out Santé Quebec. This is going to be the big, shiny new organization that was going to get everything in order and manage everything. And it's been, I think, you tell me, just disappointment after disappointment in how, or in the fact that very little has seemed to have changed.
Well, Santé Quebec is defending itself against a lot of criticism. There's been a lot of executive turnover. And they say that they've succeeded in cutting costs and reducing the number of so-called service disruptions. So they've made some progress. But I know that they've delayed. They were supposed to release an annual report, and they delayed it because the bottom line is, as you're mentioning, access to the system. Do I have a family doctor? No. When I go to the ER, do I have to wait forever? Yes. Do I sometimes leave without being seen? Yes. And, if does it take forever to get a consultation with a medical specialist? Yes. If I want to go over to the private sector and get a dermatologist, yes, but it'll cost me hundreds of dollars. So it's just, all of this reflects the disarray of our public system at a time when, aging baby boomers need it more and more, and it's placing enormous stress on our limited resources.
Not a very pretty picture. Look, again, for people I'm sure who have been on that waiting list, Aaron, as you noted, at least it's some good news, assuming this thing actually can, follow through. So I guess we'll leave it at that and see what happens from there. Are you optimistic? Can I ask you that? Do you think things are heading in the right direction? I
think that, as I think I've told you this before, things will get worse before they get better. Yeah. But eventually they'll get better. I mean, the baby boomer generation, eventually, they will die out, right? That's what's placing enormous strain on the healthcare system, not just in Quebec, in Ontario, in the United States, in Europe. All these different systems, whether they're public or private or mixed, they're under enormous pressure right now. But I think Quebec is probably worse off than most jurisdictions, maybe the worst in Canada.
Oh, that's encouraging to hear. All right. Aaron Derfel over at the Montreal Gazette. Aaron, thanks so much.
Introducing Bryan Adams Radio on iHeartRadio. Hosted by Bryan Adams himself.
Join me for an insider look on a wild ride through 40 years of global rock and roll.
Bryan Adams Radio. Now available on the free iHeartRadio app. Or ask your smart speaker to play Bryan Adams Radio on iHeartRadio.
Who's ready to rock?
Kids wanna rock.